It's the I Can't Mom Today podcast with Heather, the new mom, and Vera, the seasoned mom. I Can't Mom Today.
Hey, this is Vera and Heather back again with another episode of I Can't Mom Today podcast. Hi, Vera.
Hello, Heather.
We have a very special guest today, don't we?
We do. Dr. Matthew Zademan. Hello, Dr. Z.
Hello.
Hi, how are you guys doing?
Great.
Great. Thank you so much for joining us today.
Oh, no problem. It's my pleasure.
Well, I wanted to have you give us a brief background, but the way that this kind of developed is Heather said, what's it called again that you sent away?
Gut microbiome.
Okay, yeah. So she was telling me all about this, and I said, well, wait a minute. I've got a guy that I go to in Tallahassee, and he does this muscle testing, and I was trying to, and it all has to do with nutrition and your gut, and so I know kind of what you're talking about, but I'm terrible. I was trying to describe it to poor Heather, and Heather's like, this doesn't sound like anything I've ever heard of.
Yeah.
So, Dr. Z, I've been taking my son Luke to his practice for years because Lucas, ever since he was like 4, had these terrible migraines to the point where he'd be up all night throwing up, and he would get them like once a week, and it was just debilitating and awful. Mm-hmm. So North Florida Spine and Wellness is Dr. Z's practice, and I was recommended, he was recommended to me, and we went, and I really felt like the things that we did with Lucas really did help minimize his migraines, and now he gets them maybe once every few months, as opposed to like every week. So that was kind of the background. That's how it all developed. And I was like, we need to get Dr. Z on the show so he can explain all this. So that's my little background from my angle. But if you want to just go ahead and explain what you do, give us a little bio.
Well, I'm a chiropractor. I've been in practice since 2012. And this is all stuff, you go to school to be a chiropractor, you usually just go and learn how to correct musculoskeletal issues. So back pain and neck pain and even headaches and all those things can be helped through that. But, one thing that you end up getting a knack for as a chiropractor is you learn that how interconnected the body is between the neurology, the organs, all those things intertwined. And while chiropractic can help quite a bit of different things, there's definitely environmental factors, whether it's chronic infection, environmental toxicities, food sensitivities, all these kind of things can impact our health. And so I quickly learned some additional techniques where we could actually identify some of those causative factors, and then also what could treat them. And a lot of times when you use it appropriately, you can get incredible results on chronic issues that people are suffering from, where traditional medicine just comes up short. And a lot of the reason that is because we have a healthcare model that's basically treating crisis care. And frankly, a lot of people who feel bad, they don't have a full-blown disease. They just have a lot of dysfunction. So the problem is that the blood tests that we traditionally do aren't designed to discover dysfunction. They're there to discover those diseases. And we need that. And that's an important thing that we utilize. Mm-hmm. However, there's things that the body will tell us if we know what to look for. We just have to find a unique way to do that. So, I was working for another physician, another chiropractor who had done some training and some muscle testing. And essentially what you're doing is you're taking the muscle tone of any muscle, and then you're doing different challenges to it neurologically. And you could be stressing different organ systems and seeing how that muscle tone changes. And then you can also use different nutrients to see if that does improve. And what's cool about it is you can run different labs and correlate these findings, and a lot of times they're dead on. So it's a really unique way to find dysfunction and also treat it.
Well, and I know for myself, because I was diagnosed with rheumatoid arthritis, and as you know, Dr. Z, they still, to this day, I still don't test positive in my blood for RA. And I've been told that there's a reason for that. And another doctor I went to, a rheumatologist up in New York, said, yeah, I'm not going to put you through another blood test. I can tell already just by looking at you that, yes, you have RA, and here's how we're going to treat it. There are so many, like you were saying, like the blood tests are great for a lot of things, but I still would be, if I hadn't gone to that doctor in New York, yes, it wouldn't have changed my symptoms or anything, but at the same time, it feels so much better to have someone say, yes, you have RA, like instead of this undifferentiated, whatever it was they were trying to say, before I went to that other doctor, if that makes sense.
Mm-hmm.
Absolutely. Absolutely.
So can you explain, well, Heather, why don't you tell him about your Viome thing and what that is exactly?
So I follow, Vera and I both follow this health and wellness person, plus she does a bunch of other stuff as well. But she's been doing this thing where it's basically trying to help heal leaky gut, because a lot of research is going back to the reason why we have all these diseases right now is because of leaky gut, and it can be healed by things that we eat. So there's this test, and for lack of better terms, it's a poop test. And
that's the technical term.
It's just funner to say it than whatever it probably is. Anyway, so you send it off for a sample, and you fill out a questionnaire and a bunch of other things. It's not just them testing it. So it's basically telling you what you should and shouldn't eat.
Right. There's lots of tests out there that are looking at functional analysis, and really, I will say that's probably the key thing that we always focus on is the gut. I mean, that seems to be something that's commonly affected in a lot of people with chronic disease, especially autoimmune disease. And all right, so for a lot of people who don't really truly understand what leaky gut is, essentially what's happening there is you have a lining in your GI tract that essentially allows good things in and keeps bad things out. And so that's awesome. It's a great system when it works. The problem is that there's a lot of environmental factors that have been shown to break that down. And that's when we get more increased food sensitivities. And when we say food sensitivities, I think it's important to differentiate that from a true food allergy. So, when we talk about allergies, a lot of times we think of peanuts or even celiac disease with gluten or those types of things where we have these really bad reactions. We could have anaphylactic shock. We can have, breakout in hives. Those are a different type of reaction in the immune system that's pretty obvious to figure out. But sometimes with food sensitivities, it can take 2 or 3 days for those sensitivities to manifest with actual symptoms.
Mm-hmm.
And that is really common with the more leaky your gut gets, because what happens is that lining breaks down, and it breaks down for a variety of reasons. It can be environmental toxins, even the chemical that's involved in the herbicide Roundup is shown to break down our gut lining. That's a real big problem because we're using more and more of that in our environment.
Yeah.
And then you have, chronic infections like yeast overgrowth. Candida is a fungus that a lot of people are familiar with. Bacterial overgrowth is really underrated in my estimation. Clostridium bacteria especially is something that we see a lot, and those will break down the gut lining. And it's kind of a vicious circle, because the more that gets broken down, the less enzymes you have, the less you're able to break down foods, and the more reactive you get. So while it's great to find out what foods that may cause that inflammation, it's important to heal it, because it's just going to get worse unless you work on some gut healing in there as well.
Mm-hmm. And basically, I can only eat a few herbs and bitter vegetables.
Is that what your thing said?
Essentially.
And that does happen. I mean, some people their immune system is so on fire that they're reacting to everything, and so now that should get better. The more you stay away from that, you get the immune system cooled down, and you heal that gut lining. That should expand. And food sensitivity testing will often change over time as things improve. So that's the good news there, is usually those things aren't always permanent. And they shouldn't be. It's when you really think about it, it's abnormal to be that reactive to all of these foods.
Yeah. And I mean, I joke, obviously. I can eat a lot of meats, and but it really is a lot of bitter vegetables, which I'm like, oh, I hate those. But the things that you traditionally, and the doctor or the person, he's not a doctor, that is behind Viome, and obviously has doctors on staff and nutritional people that are working in this company. So it's not just a random man telling you what to eat. He said that a lot of the vegetables that people think are supposed to be really good for them are actually are not suitable for everybody. So it says that I should be minimizing avocado and asparagus, broccoli, kale, spinach, like all the stuff that I pretty much ate.
Yeah.
Absolutely. It's not always bad foods that people react to. And that's really tough to explain to people sometimes. It's like, not that this is a bad food, and they get frustrated. Mm-hmm. And I get it, because they're trying hard. They're getting away. I get people who get away from processed foods, and, they might react a lot to certain vegetables that give off a lot of sulfur compounds. And so that ends up making them feel horrible. Sulfur. Yeah, and so they end up feeling horrible, and they're like, I'm eating better, and I feel worse. Mm-hmm. And this is because they're getting into the wrong types of food for them. And I think the take-home message there is that everyone's different. I think we really like to have these broad spectrum recommendations for people, like A, B, C, and D are good. Mm-hmm. And the truth is that everybody's genetics are a little bit different, and how they're going to respond to even different treatments are going to be different. So I think that's the big thing, is that medicine needs to get a lot more customized. We're trying way too many big interventions that are basically the same for everybody, and that's just not the reality of how the body works. Yeah. So it has to be a lot more personalized.
Yeah, well, that's what brings me back to the muscle testing, and how, because I try to describe it. I'm like, well, you lie on a table and you have your arm up, and then, there are different chemicals and everything. Can you explain it a little better than how I just explained it?
Yeah, because that's the first thing I say when people come in to see me. It's like, oh man, everyone's going to think I'm a witch doctor here, which my family still calls me, but that's okay. They still ask me, they still want me to fix them all the time. So that I've come to terms with that. Really the underlying, and I think this helps, is knowing the underlying science behind it. And so I'll try to do that without boring everybody. But, essentially it's under the same context of essentially how an MRI works. So when an MRI is scanning you, right, there's this big magnet, and there's no magnets involved in what we do, by the way. But basically there's a big magnet that goes back and forth, and it's basically stimulating what we call resonance frequencies. So it's non-visible light. So it's light that's on the non-visible part of the spectrum that comes off all of our cells, and they're all unique for each cell. Okay. And so when that happens, those different frequencies are able to put like a little bit of different color, and that's where they get the image from an MRI. So we can actually take that same underlying science, and what we're doing is using different frequencies that are able to be implanted in vials that have, basically distilled water in them. And then you can actually have like different frequencies of different types of viruses, or different types of toxins, or different types of foods. And then you can see how neurologically the muscle tone of a person changes when you stimulate, where you just basically press that frequency up against their skin and see how it changes. And there's actually a lot of research that is involved in this science, this kind of biophoton, bioresonance type of testing. It's just the application into a clinical setting is what's unique, and we're still learning about. And that's why we also use other tools. I would never go and say, hey, I'm going to use just this one thing to figure everything out, because, there is still a experimental aspect of it. But, really to get tough cases better, you have to be outside the box a little bit if you want to try to get different results. So we do that quite often. We use poop tests. we have to do that a lot. We do urine tests that look at different organic acids that our body gives off. So there's a bunch of different ways we try to utilize different tools to try to correlate our results or our findings, so we can give the best treatment. So, does that make some sense?
It does. It's
insane.
What? Go ahead, Heather.
It's just insane.
I know. Well, I find it fascinating.
I agreed, but it's just like who. I was just talking about this today. Is that if it was left up to me, I'd still be hitting rocks with sticks.
And this is not like it's really not new. The underlying science of it is not new. I mean, there's a doctor. I think he was German. His last name is Dr. Popp, P-O-P-P, who started discovering a lot of these different resonance frequencies. And it's a lot of it too. A lot of it we use in very conventional treatments, like cold laser, which is using light to stimulate healing.
It gets rid of
different
cellulite,
frequencies.
Doesn't it?
It does that too. Yeah. There there are some applications of that.
Cool therapy. What is it called? Cool sculpting.
Right. So there's a lot of stuff like that out there that's been around for a long time, and it's really been a lot of different practitioners perfecting it and changing it over the years. I mean, there's even devices out there that are starting to register some of these frequencies. They're just not real consistent, to be honest with you. So essentially, we're still driving a manual transmission now with this testing. I'd really feel confident in the next 10 years we'll have something where, we just scan your body. It's almost going to be like, Star Trek, just scan the body there and figure out different things from those biophotons.
Well, there was another test that I did on the computer that had more to do like with neurologic, like with your brain kind of. Again, I'm so bad with technical terms.
Right. Yeah. And it's,
yeah. What can you explain that one too?
So that's a real big part of our practice. I don't believe, I really feel like you have to try, treat the body and the brain to get good results, because, as much as we see, we kind of think of, oh, my stomach hurts, I must have a problem with my stomach, right? Or my, my back hurts, so I must have a problem with my back. We got to remember that what controls everything, whether it's your immune system, your gut function, your heart, your everything, your brain, your nervous system controls all of that. And sometimes the brain gets ignored when we're treating even from a functional medicine perspective. Even when we treat depression or autism from a functional medicine perspective, those types of things that are dealing with the brain, we often treat the gut, which that makes sense. And there are pathways where the gut talks to the brain directly, and you can improve the brain by improving the gut. But that's also a two-way street. So the vagus nerve that comes up from the gut, that when you hear about people fixing their brain by fixing their gut, that's the mechanism that they're hitting, is they're improving that vagal nerve tone from the gut up to the brain. But it's important to realize that nerve also comes from the brain down to the gut. So the vagus nerve talks from the gut to the brain, but it also talks from the brain to the gut. So you really have to look at both of those. So we use a device called Right Eye, which has been awesome, and it measures functional eye movements. And so we're not looking at vision, but we're looking at movements that different parts of your brain control. So, when you're, watching a car pass you or watching somebody walk past you, you're doing a pursuit and you're tracking. And then when you kind of look in your peripheral vision real quick and come back, you're doing a saccade, or when you're reading, you're doing a lot of saccades. And these are all different eye movements that are controlled by different regions of your brain. So if you have a concussion, let's say you get in a car accident and your front of your head hits the steering wheel, those saccades are controlled by your frontal lobe. So it's real nice to know what your saccades are doing after you've had a brain injury in those areas. And so these are all ways we can kind of screen a person and say, hey, are there real deficits in this person's brain functionally? And so we can also do rehab with that as well to strengthen those areas. Otherwise, you find a hard time getting those people better, because basically their computer telling their body how to do everything isn't operating well. So how are you supposed to fix something if the control center's down? So that's a real big part. And on the flip side of that, if you try to fix the brain and the body's inflamed, then you're going to have a hard time getting the brain better too. So, really got to treat both sides of the equation.
Yeah. Oh, it's so fascinating. Sorry.
Well, I think also our health system isn't catered to this.
Well, no, unfortunately, insurance. Yeah. Well, it's not like Dr. Z said earlier. We're treating the symptoms instead of trying to fix it from the core.
Right. And I think the way I look at this is, it's not like we don't do some things really well. If I have a heart attack or I get in a horrible accident where I need my life saved, we have a great system for that.
Yeah.
We do. The problem is we treat everything from that lens. So everything's, we're waiting.
Reactive.
Exactly. So how many times have you been told, well, this is high, this is not quite normal, but, it doesn't really legitimize doing any medications. That's probably not going to help anything. So we're just going to watch it and wait till it gets worse, essentially.
Yeah.
And then once it gets bad enough, then we'll treat it.
Mm-hmm.
And so, and honestly, you wouldn't, if they did treat with these medications they have, a lot of these functional problems, it would make everything worse. So, they're just really not
the model that they're looking at you at. And frankly, it's not that I'm saying my model's good and their model's bad. I think we need a combination of both. Because we're really good at saving lives, but we're really bad at keeping people healthy. And that's the thing is that no one wants to talk about politically, is that no one has a good healthcare plan because no one's dealing with the issue that everyone's sick. And we're getting to the point where I think it's something like 2/3 of the population has at least one chronic disease. And if that continues, then there's no way for healthcare costs to go except for up.
Mm-hmm. Yeah, that's very true. And I said to my husband one day, I was like, I feel like I can't watch TV without seeing at least 2 or 3 different commercials for some sort of drug or another. And, and I remember before I was diagnosed with RA thinking, gosh, do that many people have RA? And now, sure enough, now that I have it, because obviously you don't walk into a room and say, hey, what's up? I have rheumatoid arthritis. How you doing? Yeah. But you start talking to people, and the more you talk to people, the more you realize, oh my God, I've just found like 5 people that have RA, and then a couple other people that have lupus, and a couple other people that have, celiac, and a couple wow,
Mm-hmm.
It just does. So 2/3, I guess that really does kind of make sense.
Absolutely. And all those things are increasing, and the stats show it. And, essentially at some point, everything's increasing at a rate where you got to say, okay, there's got to be something that's happening here. And the easiest thing to say is genetics. But what's changing our genetics? Genetics change, those things change pretty slowly over time. So the idea of these things increasing so much, and there is some that, we're more aware of different disorders, so we're diagnosing them a little bit more. There's more screening for some of these things, and that's without a doubt a certain factor. But there's other things out there too. I mean, there's things like epigenetics, which is a really cool emerging field. And essentially what that is, it's, we kind of think of genetics as hard mutations where, they're just genetic diseases. And epigenetics more looks at how the environment, how different toxins will end up causing a bad expression of genetic material. And that can change health very quickly over generations. But you can also treat some of that. Like, there's things where essentially think of it as like you have enzymes that either run too slow or run too fast that operate on different body systems. And what you can do is a lot of times you can, we're still learning about this every day. So it's kind of hard, we're still not real good at knowing exactly what works with all of these situations, but you can use different things to speed up or slow them down and make them run more efficiently. So, there are some good reasons why they're increasing, but we definitely have to work on, what our food supply, the quality of it. We eat so much processed foods. We use so many chemicals, in so many different ways. I mean, even the CDC has been tracking our body burden for a while now, and it's almost like 300 different chemicals that's in the average person.
Wow.
Yum.
Isn't that awesome?
Right? It's so true. I mean, really, if you go back to eating like your grandma would eat, you just you have a piece of chicken and some vegetable and some potatoes, and, you're good to go.
So, Dr. Z, if someone is looking to cut out processed food and start a healthier track, do you have any advice on where they should start? Like, should they go to their doctor and get blood work done? Should they go to, where would somebody start if they have no clue?
Yeah, that's a great question. So, if you have someone who, if you have a doctor who's, more oriented that way towards function, and there's a lot of MDs too, it's not just chiropractors and naturopaths and doctors like that. There are definitely a growing number of medical doctors who are starting to realize that there's more to treating people than, the mainstream stuff here. And so if you can find someone who's a little bit more integrative or functional, then that's a good place to start. Always having some sort of lab, some sort of idea of what kind of inflammation you have, those types of things are good ideas. It's probably going to make it easier. You're not going to get as frustrated, because I do find that people try to do it on their own, and, they don't really know a good starting point. Then of course you get on the internet and there's literally 5 million different opinions.
Yes.
And so,
and you have like some bad disease or
exactly.
And everyone's very dogmatic about their about their opinions. If you notice that, and honestly, there's a lot of good things about a lot of different types of approaches to eating, and so that does make it difficult. I mean, there are a lot of elimination diets that you can do if you're just trying to say, hey, I'm wondering if it's something I'm eating. Could that be it? Elimination diets are pretty safe, but generally speaking, they only eliminate some of the major allergens, and sometimes you come up empty with that. But that's a pretty easy way to go about it. But I do think it's good for, especially if you've got things. I mean, a lot of people have things like diabetes and health issues that if you do that on your own, for treating diabetes, yes, cutting out a bunch of carbohydrates and sugars could be good. But if you're insulin dependent or some of these other things, you could get your blood sugar all out of whack, and then it could cause problems. So it is good to work with somebody. It's just, I think the challenge is finding a practitioner who's thinking that way. Otherwise, you don't always get a lot of help.
Yeah. Well, and you worry too that whoever you find, so say someone decides rather than go, to try a functional medicine person, how do you know that particular person is on the up and up,
Sure, absolutely.
I'm sure there are some charlatans out there, and I just got lucky, being recommended to your practice, but some people, I'm sure that it must happen where people just get led around, and misled, basically.
I think the big thing, and one thing I would suggest to people on that end is just see what their training is, like if they've just been to chiropractic school and that's all, and then they went to one weekend seminar and started to do some nutrition, then, you may want to ask, hey, what training you've done.
Credentials.
There are some good organization, functional medicine universities, pretty good. And then there's, I think the International Board of Functional Medicine or something like that. That's a good organization. Dr. Heyman is in charge of it. I'm totally blanking on that right now, of course, but, like for instance, for me to get my certification, which is is from Functional Medicine University, that was 300 hours. So that's all postgraduate. So, you really want to have, that's one thing I think people can do is ask, what kind of training you've done. And then you can research those organizations on your own and, kind of look to see if they look like they're legitimate or if they have accreditations. Most of the time, they're good if they're able to get continuing education hours to for different organizations. So there's also a board of clinical nutrition that a lot of practitioners will have that will definitely give you a good idea that they're on the up and up. But that is important because there's no doubt that there's some doctors out there who are doing all kind of funky things. And I don't mind if you're outside the box a little bit, but you got to make sure you're competent enough not to do no harm, essentially.
Right. Yeah.
And so that's really, really important because, even herbs and different things like that can interact with medications, and you got to know to not screw that up because that's really, really important. But you can also go to the American Clinical Board of Nutrition. That's acbn.org. And that's a certifying agency that does basically a diplomat status. So that, there's a board exam involved with that. They've got different approved seminar and courses. And so, I wouldn't say they have to have that certification, because I know a lot of great doctors who don't have that, but they have links to different, other organizations that they approve of. And so I would say those are things that would be good for people to know.
Yeah, no, that is helpful because at least it points you in the right direction.
Absolutely.
All right. I think that's it for today. Dr. Z, thank you so much for joining us. That was awesome information.
Thank you for having me.
And is there any kind of contact information? I don't know what your availability would be if you do like any kind of consultations that are over the phone or internet? I know that's like the new thing for people.
Video chatting with doctors.
We do that there, and even if I can't help you because of distance issues or anything like that, there are, like I said, we do other testing that can be done more distance, and we do that. The best thing to do is just go to our website. It's www.healthytallahassee, which Tallahassee is TALLAHASSEE.com, and then you can get our all contact information and just call our office, and we can set something up from there.
Perfect.
Thank you so much.
Thank you.
So thank you for having me.
Bye.